Okay, looks like our participant count has kind of leveled out, so we're going to get started. So good morning, everyone. Thank you for joining us. Today is our final presentation of the fiscal webinar training series that we have done over the past, 2.5 months now, I think. And today we're going to discuss the early childhood mental health consultative services. So this webinar today is being jointly presented by the California Department of Education's Early Education and Nutrition Fiscal Services Unit of the Fiscal and Administrative Services Division, and also the Early Education Division. So for those that do not know me, my name is Corey Kahn. I'm the manager over the Early Education and Nutrition Fiscal Services Unit, which we also often call ourselves EENFS. And today I'm joined with the EENFS fiscal analysts, all of our managers, and then we have our EENFS presenters, which is today Alyssa Rodriguez and Janelle Otani. And then we also have a few representatives from the Early Education Division, two of which will be presenting, and that is Nadia Kersey and Crystal Devlin. So as we've done in all of our other webinars, we've disabled the chat box for participants, but CDE staff will be sharing links through there for you all to copy and paste for your reference. And our team is committed to being as responsive as possible, but we may not be able to answer every question. So please utilize that Q&A feature to ask us questions, but give us as much detail as possible before clicking the submit button. So that would include like your vendor number or agency name. It would also include just information, like build up your questions in case that we haven't gotten to it and we've already moved on to a different slide. So especially including your agency name or vendor number, it will help us in case we did not get to your question. We'll be able to use that information to hopefully follow up with you with an answer. At the end of this presentation, Corey Kennedy will be facilitating a live Q&A where if there's any frequently asked questions that have come through during this presentation, he may address them there live. And then also it's your opportunity to raise your hand and we can call on you to ask your question. And again, if we aren't able to get through all the questions, we will either reach out to you directly, or we are also working on a frequently asked questions page, which I'm going to show you in the next slide. So before we get started this morning, we're going to, as I have in the past, I'm announcing that, we built this webinar dedicated to fiscal webinars and trainings. And that webinar, or that website can be found at https://www.cde.gov/SG/webinars-and-trainings.asp. This link has been posted in the chat. And our office, as we are today, have been recording the webinars, and one of our team members, Jenny Tran, has been diligently working on transcribing them for posting. So when you navigate to this page, you'll find a table. Right now it has 3 columns that identifies first the date in which the webinar took place, a link to the recording, and then a summary of the training topics that we covered. So the first one, for example, was conducted on November 13th, 2024. It was entitled Enrollment, Attendance, and Fiscal Reporting Requirements. In the second column, you'll see that link there. And we went over during that webinar reporting requirements, enrollment and attendance source documentation, and revenue and expense source documentation. So what, as I said on the last slide, what you don't see here yet is a 4th column. So we are going to build this out, and we're going to include a fourth column that will include frequently asked questions that we've received over the last 10 webinars. So after this webinar, our team's going to be sorting the questions that we've received over the last 10 webinars. We're sorting them by topic. We're going to review everything that had been responded to. Once we've reviewed these answers and we've gone through the approval process, we will be posting them to this table by topic. So that fourth column will be shown on probably the right-hand side. So on this slide, you only see a couple of webinars that have been posted, but if you navigate to this page, you'll actually see 7 of the last 9 webinars have been posted. So we are continuously transcribing them, getting ready for posting, including this one. It's usually taking about a couple weeks. So just as a recommendation, if you're looking for a specific webinar that we've conducted in the past, just periodically navigate to this page just to see if the one that you're waiting for has been posted. So before I hand it off to our presenters, they wanted me to go through the agenda for today. So the topics that we will be discussing today during the webinar include, so we're going to be going over the sections of law that relate to the California preschool program and early childhood mental health consultative services. So we've shortened that. You might see it as ECMHCS, but we also refer to it just as MHCS. So we'll also talk about eligible mental health consultation services, who can provide these services in order for it to be eligible for an additional reimbursement. We'll then go over requirements for reimbursement and documentation to provide during a contract monitoring review, and that's where, you know, our EED PQI unit goes out. It's your program consultants that go out for a review. So then EENFS staff will then go over how providing these mental health consultative services can affect your reporting and reimbursement requirements. So specifically, we're going to review the adjustment factor differences between MHCS and non-MHCS adjustment factor categories. We're going to discuss how to report the child days of enrollment on the enrollment attendance and fiscal reports that you find in CPARIS. And we're also going to go over MHCS versus non-MHCS reporting examples. So that's what we're going to cover today. I'm now going to turn it over to Nadia, who will begin providing an overview of the mental health consultative services.
Thank you, Corey. Good morning. My name is Nadia Kersey, and I'm a child development consultant in the Inclusion Support Office. We wanted to start with sharing some information around the legislation related to the Early Childhood Mental Health Consultation, or ECMHC, or as Corey called it, the MHC consultation. California's Early Education Code, Section 8243, establishes a framework for early childhood mental health consultation services within the state's preschool program. The primary intent of Education Code 8243 is to ensure mental health support for children enrolled in California state preschool programs, or CSPPs. By integrating mental health expertise into early childhood education, the goal is to foster positive outcomes for children and their caregivers. First, Education Code 8243 aims to improve interpersonal relationships and enhance outcomes for children. This includes promoting healthy social emotional development and strengthening interactions between children, educators, and families. Second, it seeks to increase the confidence, competence, and overall well-being of educators and caregivers. Mental health consultation provides them with the tools and strategies to support children effectively. Finally, the code aims to eliminate suspensions and expulsions in early childhood settings. This is achieved by addressing the behavioral concerns constructively and creating more inclusive learning environments. If you're a CSPP contractor and you decide to use the ECMHC services to help teaching staff and families manage challenging behaviors in the classroom or family childcare home, you can claim an adjustment factor of 0.10 according to Education Code Section 8244. The overarching goal of these provisions is to foster positive interactions, buffer the effects of toxic stress and trauma, and cultivate an inclusive learning environment for all children. In summary, the intent of California's Education Code 8243 and the ECMHC services is to integrate mental health expertise into early childhood education settings, thereby promoting the social emotional development and well-being of young children, supporting educators and caregivers, and reducing the need for disciplinary actions. It is also worth noting that California's Assembly Bill 2806 built upon the original foundation of Education Code 8243, reinforcing the state's commitment to supporting mental health in early education settings. Next slide, please. Let's now define what qualifies as eligible early childhood mental health consultation services. They include, but are not limited to, all of the following: support for caregivers to create trauma-informed, proactive, and inclusive environments and respond effectively to all children. Assistance through consultations, offering resources, training plans, referrals, and other methods tailored to the unique needs of programs and providers. Skill development and collaboration, assistance to providers, parents, legal guardians, and caregivers in developing the skills and tools necessary to support children's development and early learning. This includes observing environments, creating action plans, and supporting their implementation. Strategies for addressing prevalent child mental health concerns. Development of strategies to address prevalent child mental health concerns, such as internalizing, or example, withdrawal, and externalizing, or persistent and serious behaviors. Then, supporting for maintaining children's safe participation. Providing support and documentation for maintaining a child's safe participation in the program if they exhibit persistent and serious behaviors. Communication through various methods, face-to-face interactions or video-based platforms and other modes of communication that are compliant with the Federal Health Insurance Portability and Accountability Act, or HIPAA, such as the telephone. Group or individual consultations based on the above actions. Next slide, please. Okay. Who can provide the early childhood mental health services to receive the additional reimbursement? First off, are licensed mental health professionals. This includes marriage and family therapists, clinical social workers, professional and clinical counselors, psychologists, child and adolescent psychiatrists, credentialed school counselors, or school psychologists. These professionals must have at least 3 years of expertise working with children aged 0 to 5, training in infant, family, and early childhood mental health, adequate insurance, and a minimum of 2 years holding their license and be up to date with all continuing education requirements. Next are license eligible professionals. These are individuals who are eligible for licensure, such as marriage family therapists, clinical social workers, professional clinical counselors, psychologists, or child and adolescent psychiatrists. They must be supervised by someone who meets all the criteria mentioned above. We also can include master's degree holders. These are individuals with at least a master's degree in a related field, like mental health or human services, and at least 2 years experience working with children aged 0 to 5. They also need to be supervised by a qualified professional as described above. Finally, we have supervisors, qualified professionals who meet all the criteria and can supervise license-eligible individuals. They can be employees of a contracting agency, work part-time, or be external contractors, as long as they provide regular professional guidance and support. An additional requirement, anyone providing these services must pass a criminal background check. Next slide, please. Costs related to the ECMHCS are reimbursable if all of the following apply. Services must be provided regularly and consistently throughout the program year, significantly contributing to A, improving interpersonal relationships and child outcomes, B, increasing the confidence, competence, and well-being of those consulted. C, eliminating suspensions and expulsions. Services are provided by an early childhood mental health consultant per statute. The consultation services should use a relationship-based model that emphasizes the strengthening relationships among early childhood education providers, parents, children, and community representatives. It should also integrate reflective practice into the on-site consultation model. This model includes conducting mental health assessments in early care and education settings at least twice per program year, using tools like the Climate of Healthy Interactions for Learning and Development, or CHILD, or something similar, keeping records that adequately document all consultation activities. With parental or guardian consent, screening each enrolled child at least once for adverse child experiences and resilience factors. Within the first 30 days upon hire or start of consultation service, a provider agency ensures that a consultant is trained in the following 4 areas: California law and professional ethics for children, for early childhood mental health consultation, child abuse and neglect mandated reporting laws, best practices and foundations of early childhood mental health consultation, and all relevant laws and regulations regarding state and federal child care programs. Consultants and supervisors shall participate in continuing professional development and education for at least 18 hours per program year. Topics may include, but are not limited to, infant, family, and early childhood mental health, implicit bias and equity, trauma-informed practice, and early child development and consultation. I will now turn it over to Crystal, who's going to discuss document retention.
Thank you, Nadia, and good morning, everybody. Thank you for joining us today. I'm just going to cover the documentation that contractors need to retain and evidence that you will provide during a contract monitoring review. So when a contractor is claiming the additional adjustment factor, the reviewer will request that all of the following documents be on file during the contract monitoring review process: the license of the ECHMC professional, and the contract or agreement or job description for that professional, detailed documentation of the specific early childhood mental health consultation services that the licensed professional is providing, including the types of challenging behaviors or concerns in the classroom or family child care home setting, your plan to provide mental health consultation services, including the frequency of services to be provided, and a copy of the CPARIS report for the time period in which the mental health adjustment factor has been claimed. For reference, Management Bulletin 19-02, available on the CDED webpage, explains the requirements for retention of documentation. And now I'm going to turn it over to Alyssa Rodriguez from EENFS, who will go over reporting of the mental health consultation services.
Thank you, Crystal. Hello, everybody. My name is Alyssa Rodriguez. As Nadia and Crystal have explained, CSPP contractors can receive additional reimbursement to cover the cost associated with providing early childhood mental health consultative services. Specifically, Education Code Section 8244 includes an adjustment factor of 0.1, which can be claimed in addition to any other single adjustment factor. This additional adjustment factor applies to all children within a classroom or family child care setting when ECMHCS are provided. So what do we mean when the 0.1 adjustment factor can be claimed in addition to any other single adjustment factor? Well, Education Code 84244E1 states that the days of enrollment for children who meet more than one of the criteria shall not be reported under more than one category. However, Education Code Section 8244E2 provides for exception when it comes to the 0.1 MHCS adjustment factor. For reporting purposes, the CDE still limits contractors to reporting child days of enrollment within one category on the enrollment, attendance, and fiscal reports in California Preschool Accounting Reporting Information System, also known as CPARIS. The CDE instead has developed specific MHCS adjustment factor categories within the enrollment, attendance, and fiscal reports that include the additional 0.1 adjustment. The chart shown on the screen, we can see how the mental health consultative services adjustment factors differ from the non-mental health consultative services or regular adjustment factors. On the second row of this chart, the adjustment factor category 2 years old and 3 years old full-time, we can see the non-MHCS adjustment factor of 1.8 is less than the MHCS adjustment factor of 1.9 by 0.1. Similarly, you will see the other adjustment factor categories also differ by 0.1. 4 years and older full-time has an adjustment factor of 1 and an MHCS adjustment factor of 1.1. Exceptional needs full-time has an adjustment factor of 2.4 and MHCS adjustment factor of 2.5. Dual language learner full-time has an adjustment factor of 1.2 and an MHCS adjustment factor of 1.3. At risk of abuse or neglect, full-time has an adjustment factor of 1.1 and an MHCS adjustment factor of 1.2. Finally, severely disabled full-time has an adjustment factor of 2.4 and an MHCS adjustment factor of 2.5. Now let's look at how to report the child days of enrollment under the MHCS adjustment factors. Contractors will report the child days of enrollment associated with mental health consultative services in the enrollment, attendance, and fiscal report form located in CPARIS. We will now drop the link to CPARIS in the chat now and can be found at https://cparis.cde.ca.gov/CPARIS. Since the mental health consultative services adjustment factor applies to all children within a classroom or family care setting when mental health consultative services are provided, contractors would report the days of enrollment for all children within the MHCS adjustment factor categories if they provided MHCS services. For example, in a classroom of 24 children, if one child is receiving MHCS, the child days of enrollment for all 24 students would be reported under the MHCS categories in CPARIS. As stated on the last slide, for reporting purposes, while the 0.1 adjustment factor is in addition to other adjustment factors, the CDE still limits contractors to reporting child days of enrollment within one category on the enrollment, attendance, and fiscal reports. The CDE instead developed a specific MHCS adjustment factor categories within the enrollment, attendance, and fiscal reports that includes the additional 0.1 adjustment factor, and therefore, children who are reported in the MHCS category should not be reported in additional or non-MHCS categories on the enrollment, attendance, and fiscal report. Now let's focus on what this looks like in CPARIS. To report MHCS child days of enrollment, contractors must select yes on the question at the top of the enrollment, attendance, and fiscal report in CPARIS. We can see that depicted by the blue arrow on the screen now. Did you serve certified children receiving MHCS in this fiscal year? That's where you would click yes. Once selected, the MHCS adjustment factor categories will be displayed in the Certified Children with MHCS section. And there we can see that by the blue box around those. The adjustment factor categories with the additional 0.1 are identified with MHCS at the end of it. You may also notice that the MHCS adjustment factors match the table we went over a few slides ago and are higher than the non-MHCS adjustment factors. And you can see that now with the arrow to the bottom right. Not shown on this slide is the MHCS reporting of non-certified children. If you serve non-certified children within a commingled CSPP classroom that receives mental health consultative services, you must report these non-certified children under the non-certified children receiving mental health consultative services section of the enrollment, attendance, and fiscal report. There may be instances when a contractor also has non-MHCS enrollment to report. For example, the contractor has 3 sites and only one of those sites provide mental health consultative services. The other 2 sites would not qualify for the additional 0.1 mental health consultative services adjustment factor and therefore would have to be reported under the normal certified enrollment section. In this instance, the contractor must also report enrollment for children in the classrooms where MHCS are not provided in the days of enrollment for certified children section. I will now hand it over to Janelle Otani, who will show an example of the MHCS adjustment factors and how they can affect contract reimbursement. Thank you.
Thank you, Ellie. My name is Janelle, and I will be presenting the remainder of this presentation. Now let's discuss the Mental Health Consultative Services Adjustment Factor and the contract maximum reimbursable amount. The mental health adjustment factors do not increase the contract maximum reimbursable amount, or the MRA. Contractors must determine how the use of MHCS adjustment factor categories will affect their current projected contract earnings and budget year target enrollment numbers. For example, if you are a contractor who is currently earning your contract MRA and will begin providing services to children receiving MHCS, additional reimbursement will not be provided above the MRA. How do the mental health consultative services adjustment factors affect service earnings? Service earnings are calculated by multiplying the number of children by the applicable adjustment factor, minimum days of operation, or MDO, and the daily reimbursement rate. In this first example, we can see that there are 24 children being reported in the non-MHCS 4 years old and older full-time category. The full-time adjustment factor for 4-year-olds is 1. In this example, the contractor's MDO was $250 and their daily reimbursement rate was $61.26. Multiplying these together would result in a calculated service earnings of $367,560. In the second example, we can see that there are 24 children being reported in the MHCS 4 years old and older full-time category. The full-time adjustment factors for the 4 years old under the MHCS adjustment factor is 1.1. With everything else staying the same, the MDO of $250 and the daily reimbursement rate of $61.26, this would result in the service earnings of $404,316. which is $36,756 more than the calculated service earnings without the MHCS adjustment. Please note that service earnings are currently not in a limit of reimbursement in the 24-25 fiscal year, as we are in hold harmless through June 30th of 2025. However, contractors should still monitor their service earnings to ensure that they are aligned with the contract MRA and/or their net reimbursable costs. Mental health consultative services can be found at the EENFS website at https://www.cde.ca.gov/FG/AA/CD. Here you will find the 24-25 fiscal handbook, the contract terms and conditions, and the CPARIS user manual. There is also resources on the Management Bulletin 1902, which can be found at https://www.cde.ca.gov/sp/cd/ci/mb1902.asp. Management Bulletin 1902 FAQs can be found at https://www.cde.ca.gov/sp/cd/mb1902faq.asp. And these links will be dropped in the chat now. This concludes our presentation on the mental health consultative services. Are there any questions?